hopefully. So so as I was saying, you have a decrease in muscle tone. So if you wake up during this phase, it might take actually a few seconds, a few minutes to regain perfect neuromuscular function. So remember that. And there is also actually some other activity. You have an increase in heart rate, you have increase in blood pressure sometime during this phase, and so on. There are actually also erection during those phases. So this is used clinically to identify subject with erectile dysfunction that is linked to psychological issue from diabetes and other vascular abnormalities, because of course if it's just psychologically they will be maintained during sleep phase. So you see, you have all sorts of activity that is reminiscent of being awake and being very active, but it's asleep. So why there's this pattern? And why it's so important REM phase? There are some specific form of memory that are formed and stored during REM phase. Okay, so remember, memory consolidation, stage 4, but also REM phase is also important for memory. And so this is actually extremely important. And so this is actually the pattern. So why we have all those activity and so on. So if you do an EEG, like if you are awake, all those activity, which neurotransmitter is important for those? The most important neurotransmitter for all those functions is actually acetylcholine. So all those activity that you have, REM phase, the alpha rhythm, all those REM paralysis, and so on, they all due to excessive release of acetylcholine in different systems, spinal cord, superior colliculus, thalamus, and so on. But definitely acetylcholine is the key player. Okay. So basically we have each cycle, we have a combination of 4 non-REM phase and 1 REM phase. And again, each cycle about 90 minutes. So during a night you have several, 4 or 5 of those cycles according to how long you sleep. But those different stages, they have a different duration in different part of night. Stage 3 and 4 predominate early in the night. This is an extremely important aspect. Remember, stage 3 and 4 are the restorative. You form during this phase all molecule ATP neurotransmitter that you use during the day. So it's very early in the night. So if you go to bed, then you wake up, you are awake for a couple of hours playing on your cell phone, and then you get back in the morning, next day you're going to be tired because the overall amount of stage 2 and 3 is decreased because it's in the early phase. REM, it's predominant later in the night and in the morning. What happened during this REM phase? We have dreams during REM phase. So we basically consolidate memory early in the night and we dream late in the night or in the morning. So you might have actually subject that tell you, I never remember my dream and everything. If you investigate in many of those patients, they tend to wake up early. They usually, sometimes they are clustered just minutes or before waking up. So late, very late in the night, those dreams. So we have a cycle. That's what you get if you do a sleep study. They hook you up to an EEG, you will sleep. The EEG will record your electrical activity in the entire night. You will have also other sensors for respiration, blood pressure, and so on. neuromuscular activity for the REM paralysis, electrode around the eyes for those high movement, and at the end you will have this. So it will tell you how many cycles and the duration of those. You have some disease in which this pattern is abnormal, not just insomnia. Don't forget that we have some specific movement disorder that take place during sleep. There is a disease that is actually very funny, but extremely common, guys. Last year, each year they publish this thing of how many diagnoses of this or that condition and so on, and there is always a runner-up. So in the last 5 years, the runner-up was always a restless leg syndrome. Which is a condition characterized by abnormal leg movement. Sometimes they can be as violent as a kick or even more. They take place during sleep. It's a basal ganglia disorder. I can show you a video next week if you have some time about that. So it's really, we all make movement during our sleep, but sometimes, and of course, those movements can be so violent that the patient can wake up several times, not to mention that you wake up your partner, so your marriage will be in great danger because this is a chronic condition, guys. So it's really, but chronic sleep abnormality, remember that list of disease. So beside all, and it's linked to dopamine also this. So, and there is another condition that you have to remember, which is sleep apnea. That's, again, most of the sleep study that we do now, beside, some epilepsy and so on, they're mostly done to make a diagnosis of sleep apnea. As you know, sleep apnea is due to a temporary occlusion of the airway that during sleep that induce hypoxia and we awake. So don't forget that in a night, those patients can have about 100 to 100 moment of awakening, sleep awakening. So imagine how disrupted is the sleeping pattern. It's linked to obesity, but not just that. But definitely obese patients tend to have a higher risk of developing sleep apnea. The result is that you don't function during the day because it's a non-restoring sleep. But also there is a major issue. It's one of the most important risk factors for myocardial infarction. And the treatment is, there's no pharmacological treatment. In some cases, you can do some surgery, but as you know, those patients need to sleep attached to a respirator that have to put close to the bed. They have to carry if they travel, all this thing. I'm sure that at the airport, there's always some scene of some of those respirators that make some trouble with security and so on. They are because they needed to sleep, but there is a little mask and they needed to have this. So when there is a closure of the airway, the respirator kicks in with a positive pressure, so you don't have those awakening. Again, huge effect on cardiac health. One of the major risk factors. And many other, guys, because a sleep disorder are really a huge field. It will take me 6 months. If I have to go over to all the condition and all the epileptic seizure typical in sleep and so on, really will take, it's a huge field. But let's get back to physiology. So we know a little bit the basic. Now we need to get into the mechanism. Why we sleep and why we awake. What are the brain area? We already mentioned one, suprachiasmatic nucleus. Why we sleep? Actually, a couple of years ago, they won the Nobel Prize for this. I think it was either last year or 2 years ago that they won the Nobel Prize for discovering this mechanism. It's called flip-flop mechanism. So you have basically a loop. As I told you, some areas sleep promoting, some other awakening. You have a balance, and then this balance change in the evening or early in the morning. So beside suprachiasmatic nucleus and melatonin, we have another hormone that is secreted in from hypothalamus, a different portion of hypothalamus that is called orexin. This is extremely important, guys. Orexinergic neuron, they secrete this hormone, and it's a key area in sleep regulation. There is another nucleus in the hypothalamus, which is called VLPO. So focus on those two guys here, VLPO, which is another hypothalamic nucleus, and orexinergic neuron. So when you are awake right now, orexinergic neuron send excitatory input to the brainstem. What do we have in the brainstem? You remember locus ceruleus, we have VTA, substantia nigra, so you have a massive release of serotonin, norepinephrine, dopamine, and so on. They send input to thalamus, and as I told you, thalamus is the pacemaker, and send input to cortex. The message is generate alpha, we are awake. Okay? At the same time, they block the VLPO nucleus. Okay? So basically, when you are awake, orexinergic neuron favor the brainstem, and the brainstem block the VLPO. When you go to sleep, the VLPO take over and inhibit orexin. So you shut down the brainstem and you don't have a message to cortex. So that's why you have this slow rhythm. Okay? And everything is in here. So these are the main key players. This orexin is very important, guys, now, because it's linked to depression, it's linked to eating disorder, because sleep and eating pattern, it's very much interrelated. It's linked to depression as well, but also it's linked to a disease which is narcolepsy. Narcolepsy is a disease, a genetic disease in which you don't have orexinergic neuron. So remember, orexin was trigger wakefulness. So those patients suddenly start to sleep. They're doing something and they start to sleep several times during the day. I remember when I did my residency guide, there was one of my colleagues that he didn't know, but he started to have this pattern. We noticed this kind of strange behavior, falling asleep right away. But during residency, you all exhausted, so we really totally underestimated this thing. But instead, it was narcoleptic. Now we have some drugs that are used actually specific for narcolepsy and so on. But remember, this is the area. And remember, this nucleus is the posterior lateral hypothalamic area. Okay. What else do we know? This we don't know, that yawning is contagious, but it's has been demonstrated in, we see that every day, and but there's no neural basis that we know for this. Another thing that is important, guys, regarding this, in general, sleep and